later when your classmates who are unavailable, they will be able to watch this lecture short lecture video about how do we conduct intake interview. So now, before we begin, let's pray. Dear Heavenly Father, thank you, good Lord, for this afternoon you've given to us. Thank you, Lord, sa blessings you have showered upon us. Guide us today, Lord, as we discuss about the different topics in abnormal psychology, in particular, Lord, here about how do we conduct intake interview. And Lord, please give us wisdom, understanding, and strength, Lord God. And Lord, may you be glorified in this class, Lord God. And I just want to bring you back all the glory and honor. In Jesus' name, amen. Okay, so good afternoon, everyone, and welcome to our Kamustahan session number 3, part 2. This is already part 2 because yesterday we had a short discussion about how to do your case conference, and today I'm going to discuss your assignment, which is how do we conduct an intake interview. So the reason why I wanted this to be discussed, it's because it's one of the skills that you need to learn as we become psychometricians. So this skill that you will learn later on, you will be able still to use it in our psych assessment class. So in later on, I will discuss how do we do a psych assessment process. But we will just, in abnormal psych, we will just focus on how do we conduct intake interview and why is it important that we do this, especially if we are going into the clinical setting. So this is the psychological assessment process. So is it visible on your end? Is it readable, right? So it is from reason for referral up until intervention. That's the process of the psychological assessment. So the first step in psychological assessment is, of course, the reason for referral. So I will explain later what is the reason for referral. Then we will conduct intake interview. So these two in particular are what I'm going to focus on discussing. And the rest of these steps are more on the psych assessment subject. So this will be discussed in depth in your psych assessment subject. So after we conduct intake interview, this is where we choose what tests should we include in the test battery. And when we say test battery, this is a group of tests that we would administer to our client or the patient. Okay? It depends on what is the reason for referral. And then we administer the test. So this is where we come in as psychometricians because we are the ones licensed to administer, score, interpret, and make a psych report about the different psychological tests that are available. We also here to, after the administering of tests, we are also there to score and interpret each test results. And then after that, we integrate all the test results, and integrating test results requires not only scoring and interpreting the test results, but also what we have gotten, information that we have gotten from the intake interview. Okay, so and then after we integrate all the test results, we write them down in the psychological evaluation report. So the psychological evaluation report is the way we communicate all the test results and also what we have learned about our client or patient. So this is where we write a picture of our client. And of course, the last part is the intervention part. So in the intervention part, this is where the psychologist will administer intervention to our patient or client, especially when it requires for therapy. So, but in abnormal psychology, the skill that I want you to learn for now is, of course, how do we conduct intake interview. So, number one, like I said, in the first process for psychological assessment is the reason for referral. And this is first and foremost the nature of the client's problem. And we should determine what tests or assessment tools that are needed to be administered. So usually the reason for referral is what is the client's uh, present problems. So we ask that usually in the intake interview form. So later on, I will orient you on how to use the intake interview form and how do we conduct properly the intake interview. So of course, before everything else, before we ask the nature of the client's problem, so we must first use the informed consent. So it's always an SOP or standard operational protocol that we must inform our clients of our services, what fees to pay, and of course, what are the limits to the confidentiality. Okay, so we will practice that. So after the reason for referral is of course the when we conduct intake interviews. So the valuable information we get is always through interviewing. And usually, we interview several people. Okay. And in my experience during my OJT in my master's, so we not only interview the client, but also the guardian of the client. So especially if we are interviewing a child. So not only we must look into the perspective of the child, but we also need to look into what information we can get from the guardian of the child or any other person who will help us in getting a full picture of the child. Okay. Okay. So so usually it's the guardians or the parents, the teachers, or any individual that is familiar with the child. So this is in particular, especially if the client or patient is a minor. So usually, the difference between intake interviews and interviews that we conduct in the industrial setting. So later on, next sem, uh, you will learn about interviewing in the industrial setting with Sir Prince. So this one, so it's usually more open and less structured than formal testing, and those being interviewed had an opportunity to convey information in their own words. So usually when we conduct intake interview, so it's not usually in English. So we usually do that in the words or in the language that the person is comfortable of. So for example, if your patient or client is Hiligaynon, so you need to conduct the interview in Hiligaynon. So same if your client is Akyanon or Aklanon, so you need to speak in their language. That's why in my experience, language is really a factor when it comes to getting information. And with my partners in the OJT, so we were assigned based on the client, based on their location, geographical location. So my classmate who is Akyanon and she speaks Akyanon, so she was she was the one who conducted an intake interview to an Akyanon patient. Okay, so I hope that is somehow you got a clear picture on how do we conduct intake interviews. Okay. So before that, do you have any questions before I proceed? So far, wala man. Sige. So here, so I will give you some tips on how do we have an effective interview. So I know it's all of this are your first time to interview someone, especially your classmates. So don't worry. This is just practice. Okay, this is not yet the real thing, so it's okay to practice before you conduct your intake interview. And I will just give you some tips on how do we effectively communicate, and of course, how do we effectively interview someone. So my source is from Kaplan. So this is from a psychological assessment book, but this is really applicable in our subject also in abnormal psychology. Okay. So, what are the interview techniques? So, in this phenomenon called social facilitation, we tend to act like the models around us. So, in when you say social facilitation, so we can see that, for example, uh, what the patient sees in us, okay, the patient also mirrors it. So if the interviewer is tense, anxious, defensive, and aloof, so also the interviewee tends to respond in kind. So what we want in an interview session is we create a condition of openness, warmth, acceptance, comfort, calmness, support that he or she must exhibit these qualities. So usually the number one thing that we should avoid is, of course, making judgmental or evaluative statements, especially if it will inhibit the interviewee. So we do not use terms that are judgmental, especially in evaluating their thoughts, feelings, actions of the clients, so or patient. So we don't use such terms such as good, bad, excellent, terrible, disgusting, disgraceful, and stupid. So these are evaluative statements. So for example, uh, in my experience, so in my OJT, so it's really we get a lot of people of different backgrounds, and some of the backgrounds there are, of course, some of them are rape victims or victims of or survivors of abuse. So especially when I ask them questions, I don't ask them why it happened to them, for example, because why the question why makes them defensive. So I try as much as possible to make it that they would seem to be comfortable, and still I can get information on what really happened during that time. And of course, whatever thoughts and feelings and actions our clients had or did, we must not judge them or make evaluative statements. So we must not, for example, tell them na, do you think what happened to you was bad though? Or why did you do that? That's not that's not a good attitude or something like that. We do not tell them what to do. Okay, we do not prescribe gani. But of course, we also not judge them based on their actions. So that's a complete no-no. So we, as an interviewer, we are just there to get information. We also need to empathize with them, but we are not there to give a judgment on what they have done. Okay, done or what they have thought or felt. So, of course, like I said, we avoid proving statements. So, like asking why. So it makes the interviewees defensive. So maybe we can use how or what or when or where. But when we try to probe, and we also need to look into what the patient is feeling, if he or she is comfortable or uncomfortable in answering our questions before we proceed. So, of course, here are some techniques that you need to remember in conducting an intake interview. So, the first one is verbatim playback. So, this is where the interviewer simply repeats the interviewee's last response. So, for example, in here, in his interview with a clinical psychologist, Maria stated, "I majored in history and social studies." So, in which the psychologist replied that, "Yes, I see." So, it's a verbatim playback when you also say word for word that you majored in history and social studies. So, it means that at least the interviewee is aware that the interviewer is really listening to what the interviewee is or the client is saying. So we also have another technique called paraphrasing and restatement responses. So these are also interchangeable with the interviewee's response. So a paraphrase tends to be more similar to the interviewee's response than a restatement, but both capture the meaning of their interviewee's response. In restatement, there is an introduction of new words, and in paraphrasing, there is a substitution of key words. So, in restatement, you are restating what the what the patient or client is saying. So like for example in our example uh here, 'di ba? If the patient says, I majored in history and social studies. So when you restate, so you simply say that, oh, so you are enrolled in history and social studies program. Okay, so in there is an introduction of new words there. So we are restating the what the patient or client is saying, and in paraphrasing, substitution is um is there. Okay? So another technique is summarizing and clarification of statements. So of course, since we have a long interview, so just to be clarified with the things that we have said, and we are assuring the reliability of what our clients and patients are saying. So we tend to summarize what they have said and also clarify. So when we clarify, we tend to ask it in a question form. So, for example, like in our statement here, so if I heard correctly, for example, you majored in history and social studies. So you have studied, how many years have you studied there? So you are clarifying what the patient or client is saying. So those are just some techniques, interview techniques that you can learn. And like I said, interview skills takes practice. So these are just a few techniques that I have shared sa inyo. So, of course, this is the verbatim playback is the lowest level of communication because you are just simply repeating in verbatim what the patient is saying. So, but the highest ones are restatement, paraphrasing, and summarizing. So, they go beyond the verbatim statement, but they also look into the context, the also the gestures of the patient, the nonverbal aspects of it. So by communicating that the interviewer has a good idea of what the interviewee is trying to communicate. So a clarification shows yet a further comprehension. So if you can see here, these levels of communication all boils down to one important skill that we need to learn as future psychologist, psychometrician, which is active listening. So it's not simply, when we say simply passive listening, it's like listening to music. We listen to the lyrics, to the song, but we do not understand what the song mean or what the message is. But in active listening, just like here in our skills in interview, so we really listen. We try to analyze and also comprehend what the person is trying to say. Okay? But the most important thing when it comes to interview is of course our empathy or understanding the response. So this is not only looking into what the statements or the patient or the client is telling us, but also we know or understand how the person really feels inside. So a person may say that they are happy, but if we look into their non-verbal cues, so we can see that in their face they may say that they are happy, but deep inside they are not. So our empathy here is one of the most important skill and also an attitude that we need to learn as we go on to studying abnormal psychology. And of course, we must establish a positive atmosphere. Interviewers begin with an open-ended question followed by an understanding statements that capture the meaning and feeling of their interviewee's communication. So those are just some of the interview techniques that I want you to remember. So like I said, even this is our first time in interviewing. So there's nothing wrong if we practice first how to communicate, practice before an interview, what questions should we ask. So there's nothing wrong with that. But what is important is that we know or we are prepared as interviewers. Okay? So in summary, we need to avoid in an unstructured interview are judgmental or evaluative statements. Also, probing statements, statements that will get uh, our interviewees or patients defensive. So also hostile responses and of course false reassurances. So in my experience, so we when I was in OJT in a hospital, so patients we interview patients inside that hospital, and patients often tell us na ma'am or miss, when can we go out of the hospital? So we as psychologists, psychometricians, if our task there is just to conduct an intake interview, we are not there to give them reassurances that okay, you will go out in that specific day. So it's not our call because it's the doctor's responsibility. So yeah, we must be careful also in what we say to the patient or clients, that we may not give them false reassurances. Also, in particular, sometimes patients ask us, especially those who are victims of abuse, on when they will get justice, something like that, or when will the court sentence those that abuse them. So we are not there to give false assurances, okay, or reassurances or whatsoever, because those are things that we are not in control with. Okay, so another these are just the techniques to keep the interaction flowing. So first is the transitional phase. So yes, I see, go on. Verbatim playback. So we repeat in verbatim what the interviewee is saying. It's exact. So paraphrasing and restatement. So we just repeat what the interviewee has said, but we use different words or synonyms of that. Summarizing. So we pull together the meaning of several responses. Clarification. So we clarify. We tend to ask again the interviewee's response, especially if it's not clear. So empathy and understanding. So this is the most important one. So we communicate our empathy towards our patients and clients. So we feel on their shoes. Okay. So even though we have not experienced what they have experienced, so it's one of the skills and attitudes that we need to learn, that we must also feel what they are feeling. So that's it. So the difference between empathy and sympathy is empathy goes deeper, more emotional connection. Meanwhile, sympathy is just surface level. It's being pitiful. So you are just saying that you pity the client, which is also somehow has a negative effect. Okay, so we must also try to avoid that attitude of pitying the client. Okay, because yeah, they don't deserve what happened, but it's not we should not, or we should avoid that attitude. So of course, this is also one of the things or important matters that I want to discuss to you. So when it comes to intake interviews, so we use the mental status exam. So this is important, especially before a doctor, a licensed doctor, or especially a psychiatrist and a psychologist can diagnose someone with mental disorder. So the mental status exam helps. Okay, so it's not a diagnostic tool, but it can help the doctor, the diagnostician, to give a proper diagnosis. So what makes it different from the medical tests is that in medical tests there is a definite result, right? Here in mental status exam, so you really need to observe the client, and it may be different from one observation to another. Okay, so what is the mental status exam? So the mental status exam is the psychological equivalent of a physical exam that describes the mental state and behaviors of the person being seen. So it includes both objective observations and of the clinician and subjective descriptions by the patient. Okay, so it includes the when we say objective observations, these are the signs that we see in the patient, and the subjective descriptions by the patient is called the symptoms, di ba? So, why do we do the MSE? So, the MSE provides information for diagnosis and assessment of disorder and response to treatment. So, a mental status exam also provides a snapshot in a point in time. When we say snapshot, it's like the present moment. Okay, what is the client's current mental condition during that time? Okay, during that specific period. So, if another provider sees your patient, it allows them to determine if the patient's status has changed without previously seeing the patient. So, it is included in their medical records. And to properly assess the MSE, information about the patient's history is needed, including education, cultural, and social factors. So, this all ties in, the information that we get from the MSE all ties into what I said to you, the perspective on how we see mental disorders, the biopsychosocial model. So we look into the biological side, so the patient's history, family history, medical history, the psychological side, so the coping skills of the client, his personality, and of course the social factors, so the environment, so how was his school, how was his work, okay, and parents, and interaction with parents, and other relationships. So, of course, what is important here is also we need to ascertain what is normal for the patients. We need to put a baseline. Okay, so for example, some people always speak fast, and how we must also take note of the speech of the client, because some symptoms of a mental disorder includes pressured speech. So, especially for example in bipolar disorder, so how do we know if that's already an abnormal pressured speech, or it's just the person's way of talking? So again, it takes skills, but especially the observation skills. But as first timers who will conduct intake interview, it's okay to take down notes. Okay, so it's we are not yet experts. Okay, so we need to practice observing other people. Okay, so the complete components of a mental status exam includes the appearance. We look into the appearance of the patient or client, the behavior, the speech, the mood, the affect, the thought process, the thought content, the cognition, insight, or judgment. So this one, I will discuss it one by one, and of course some examples. So as you can see in your module 3, I have put there the signs and symptoms of mental disorder. So it's somehow related here also in the mental status exam. So those are also some things that we need to look at, especially on the objective behavioral side, okay, behavioral observation side. So appearance. So of course, that's what do you see? Okay, so first is the build of the patient or client, the posture. Okay, is the posture slouching? Is the patient slouching, or is the patient very rigid? The rest, how is the fashion of the patient? So for example, is it mismatch dress? Okay, is it also grooming? So is the patient well groomed? Okay, so you can somehow, of course, smell them somehow, diba? So not only see, but also use other senses. So prominent physical abnormalities, so we also take note of that. Level of alertness, so are they somnolent? So are they sleepy or alert, or maybe very alert, diba? So emotional facial expression, so are they happy? Are they can you see them happy, or can you see them very sad? Okay, and of course their attitude towards the examiner. So are they cooperative? So meaning do they respond to your questions, or uncooperative? So that's the opposite. So they are avoiding the questions. So you will later on experience a lot of people, a lot of patients, encounter a lot of patients and clients. So it's important that we know what is the MSE, and of course, what's the importance of looking, observing them by their appearance. So, like I said, we are not judging them, we are just observing and taking note of the information. Okay? So, behavior. Okay? So, eye contact. So, for example, when we talk to our patient or client, do they look at us from time to time, or do they really avoid our gaze, or is it piercing, like very big eyes, right? So yeah, so we must also take consideration our culture. So of course, in America, if you don't look at the interviewer in the eye, so of course they would think that it's rude. But for us in the Philippines, so we have golden quote hiya somehow. So we tend to not look at the person's eye contact, but we also need to take consideration if, of course, the person looks into our eyes from time to time or not. Okay, and psychomotor activity. So psychomotor retardation or agitation. So when it's say retardation, so everything seems slow, or if the patient is agitated, so hindi siya mapakali. So ganon. So for example, hand wringing, or for example, the patient shakes his or her leg, right? So we also take note of that. So movement, so tremors, abnormal movement. So for example, stereotypies and gait. So for example, in stereotypies, this is one of the symptoms that are being observed in children with autism. Okay, so stereotypies are repeated movements or behaviors. So tremors. So for example, if your patient has been a victim or a survivor of a certain traumatic event, so maybe when you ask those questions, the patient may have tremors. Okay, so those are things that we need to also observe. So rate. So of course, how does the person speak? Okay, so is it increased or pressured, or decreased, or monosyllabic, or very latent? Okay, so here we look into the baseline of how the person speaks. So sometimes, of course, our patient may be nervous, so they may speak really really fast. But sometimes also the patient may experience symptoms of depression, so they seem to speak in a very slow manner or even monosyllabic. So we must also look into the rhythm or articulation. Okay. So articulation. How does the person articulate the sentence or words? So do they stutter or prosody? So when we say prosody, it's the intonation on the stress on words. So how does the person speak? Do they speak every or do they stress every sentence? So that's an example. This dysarthria, so it's one of the motor speech disorder in which muscles that are used to produce speech are damaged, paralyzed, or weakened. So the person with dysarthria cannot control their tongue. Okay. Yes, ma'am.
Yes, good afternoon, everyone. And it's not my intention to really to cut you right here, but I just have to say thank you.
Okay.
I
Thank you,
listened,
ma'am.
and it is my hope that psychology students really would take much from this. And I hope, I hope
Yes
the
po.
best for all of you.
Yes po, ma'am.
Bye now.
Bye. Thank you po. Okay. Sige. Din pa to. Sige. So, dysarthria. Oh. Ubos English ko class today. Okay. So when we say dysarthria, so like I said, it's a motor speech disorder in which muscles that are used to produce speech are damaged, paralyzed, or weakened. So usually this is, for example, if the patient had a stroke, diba? So their brain has some sort of damage. So they may tend to cannot control how they're saying, diba? Or may voice box or may use slur words. Okay? So so another is of course the volume. Okay? So for example, sometimes when we ask the patient, "Kamusta ka na?" or "How are you?" So like a patient will say, wala na sila. So you must also take note of that. So is the volume of how they say loud, soft, mute. So some of them may have very cute voices, right? Or very small voices. So we must also take note of that. Okay? And content, of course. The content means how fluent the patient is saying, loquacious. So very another big word. So loquacious means talkative. So maybe the patient is machika lang yun siya. So marites. Kasi may mga mukita na pwede na ko hilonggo, no? Okay na? Okay lang mag-hilonggo ko. Wait, so, the patient may be very marites lang. Machika lang siya kasi, mga machika. So, loquacious. And positive. So, maybe the patient tend to stop at certain words. So, like, so they would say, for example, kamusta ka na? Okay lang po, ma'am. Okay lang ang akon pamatsyag. Like, they pause and something like that. So, impoverished means that they lack certain words to speak. So, utod-utod, impoverished, something like that. So, mood. So, again, diba? Let's differentiate mood from feelings. Okay? Feelings or emotions are more on the feelings are more unstable for they change from time to time. Diba? For example, currently, we're feeling happy or we're feeling nervous. That's a feeling. Mood, on the other hand, is very stable. So it's from 2 weeks. Okay? Most of the time, we look at the person's mood within the time period of 2 weeks. Okay? So this is the prevalent emotional state that the patient tells you they feel. So this is often placed in quotes. So when you take note in it in the MSE, so you put quotes in it. So for example, when you ask the patient, okay, how do you feel right now? How do you feel right now? So the patient will say, if the patient says na, I feel fantastic, I feel elated. So you put there in quotes. Okay, so these are examples of the mood. So fantastic, elated, depressed, anxious, sad, angry, irritable, or good. So we ask them, so for example, in the period of 2 weeks, what do you feel right now? Okay, so that's how we ask the question when it comes to mood. Okay? So, okay pa mo? Okay, so next, affect. Okay? So, mood is subjective. It's the subjective feeling of the client. Meanwhile, affect is the emotional state that we observe. So, the patient may say na, I feel fantastic, I feel elated, but we can see them in their eyes that they are feeling anxious, or you see them na wala sila gana. I feel fantastic. Like, you can see. That's why non-verbal cues are very important. Okay, so there are different types also of affect. Euthymic means normal mood. dysphoric, so it means depressed, irritable, angry. So that's the emotional state that we observe in the client. So based on their facial expressions, based on their behavior, so they may smile pero makita mo sa ila posture na okay lang ko, happy ko, pero ginakulbaan siya, gina-depress siya gali, di ba? Makita nyo na siya. Okay, range. So is it full or normal, restricted, blunted, or flat, or labile? So the range one, this is more on when it comes to when we try to diagnose someone, if we see symptoms of schizophrenia. So usually they have flat or blunted affect. So it means that even if they say that they are happy, so like I am happy, the very poker face lang, or like wala na. So yeah. So congruency, so does it match the mood? So mood congruent versus mood incongruence. So when we say mood congruent, so it means that what they say, so I am feeling happy, and what we observe is the same. So kumagama sila, ay nami iya pamatsyag ko, so makita mo man sa iya facial expression, sa iya nga mga behavior that they are very happy, okay, or they are in the normal mood. So another is of course mood incongruence. So that's where, for example, when they say na okay lang sila, or nagama sila nga happy sila, pero makita mo sila facial expressions that they are agitated, they are anxious, or they are depressed. Okay, so that's mood incongruent. Okay, stability. So stable. When we say stable, so it you can see it throughout the interview na wala ga change ang iya mood. Kung labile, so amo na ga change ang iya nga mood and affect. So thought process. So we also look into the thought process of the person. So this is based on certain questions that we will ask later our client. So this describes the rate of our thoughts, how they flow and are connected. So the first one is normal. So tight, logical, and linear, coherent, and goal-directed. So kumbaga when we say nga normal siya, when we ask a certain question, gina-answer niya direct to the point. So for example, how are you, kamusta ka with your family? So may istorya ya ka diretso nga, amo niya akong family background, si mama ko housewife, si papa go work sa amuni. So when we say nga thought process is tight, logical, linear, coherent, and goal-directed, so bisilingol maintindihan ta. Also ma-answer niya diretso ang imo nga question. So abnormal, so associations are not clear, are disorganized, are incoherent. So for example, are in circumstantial, tangential, loose, flight of ideas, word salad, clanging, and thought blocking. So why do we ask this question? So these are because this question somehow may check if, for example, the person may have schizophrenia. So one of the symptoms of schizophrenia is disorganized thinking. So we can measure or we can see if the person may have disorganized thinking through, of course, their thought process. So I will explain ano ni silang mga circumstantial, tangential, loose, flight of ideas, okay? So examples of thought process. So circumstantial, so they provide unnecessary detail but eventually get to the point. Okay, so for example, they add excessive details and extra information that makes it hard for people to follow your conversation. So kumbaga gina circle ginalibot-libot ya lang ang istorya pero wala siya they are not getting into the point. Okay, so for example, a neuroscientist and neuropsychiatrist, for example, nagambal siya ang psych nagambal siya, what is your name? So ang response bisang patient is, well, sometimes people ask me, I have to think about whether or not I will answer because some people think it's an odd name even though I don't really, because my mom gave it to me and I think my dad helped it, but it's as good as my name in my opinion. But yeah, it's Tom. So instead nga ihambal ya diretso iyang alan, so ginaliko-liko iya na istorya before siya kalabot sa main point. So amo na ang circumstantial. Okay? Tangential naman is they move from thought to thought that relates in some way but never get to the point. So, kung si circumstantial, ginalibot niya na yung istorya before siya, pero makakadto man siya sa point. Si tangential, wala. Gatangent, kumbaga galayo ang istorya, pero wala yagid gapon na hambal ang sabat, which is, for example, to, what is your name? So, ginaliko-liko ilang istorya. So, for example, kung mamangkot ka be sa iya, din ka nagkadto or something like that. So, naghambal siya ang patient. Nga, I got really mad as I was waiting in line at the grocery store. I cannot stand lines, waiting and waiting. I waited for a long time to get my driver's license. Driving these days is just crazy. So, galayo ang istorya and never siya naka-arrive sa imo nga ginapamangkot. Okay? So, when we say loose naman, so illogical shifting between unrelated topics. So, for example, what is your name? Ang pamangkot, pero naglabot siya kung mga TV shows niya na pang tanaw niya, muna na. So, loose ang thought process niya. Illogical shifting. So, for example, may patient ako nga makita ko ganyan nga may symptom siya of schizophrenia. Namangkot ko nga, ma'am, ano imo ngalan? Ang butay, wala, gusto galayo, gina iya storya. Tapos, namangkot, ano ka ma'am, bayi laki. Okay, so, hindi ako masabat diretso, do ginaliko yang istorya, do illogical ang iya nga mga thoughts, and syempre hindi ko man mahambal kung sino na siya ang patient. Pero na, ang example na mga loose or illogical, do gina-shift away. Kung kisa gani, hindi na siya gani gusto magsabat, kay gusto niya ang iya nga guardian ang masabat para sa akin. Pero, na, at least, gina-take note namon ang mga behavior niya. Okay? So, flight of ideas. So, quickly moving from one idea to another. So, usually, flight of ideas, these are common or makita, observable to people with mania. So, or with bipolar. So, when we say ara siya sa manic stage niya daan, they are one of the symptoms is they are very elated. They are very elated. Also, kadasig. Kung magkakadasig sang thought process nila. And, sometimes they quickly move from one idea to another. So, for example, if I'm talking about the MSE, sa sobra ka flight of ideas ko be, for example, nakalabot na ko sa schizophrenia, nakalabot na ko sa sex disorders, na, kumbaga, ang discussion that would be for modules 4 to 6, na-compress ko in this lecture. Okay? So, that's one example of flight of ideas. So, quickly moving from one idea to another. So, thought blocking. So, thoughts are interrupted. For example, when you ask especially sensitive questions, so, mastorya na siya tani, pero nag-stop siya. Okay? So, you take note of that. So, syempre, be careful ka lang not to probe, especially kung very sensitive ang topic na. So, not only, kay daan ako, not only I experienced interviewing someone with who was abused, okay, or mga victims of abuse, may araman ko na gina-interview. So, ang akon nga thesis is all about mga children in conflict with the law. So, syempre, society views them as criminals, diba? So, but, I'm being careful about talking about what their case is. Okay, I'm not really probing what happened. Okay, kay syempre, the person may feel na, ay, basi gina-judge mo ko based sa akon nga action. And especially if ongoing pa ang case. So, you will learn that later on. So, when we talk to people, nga, damo sila experiences that we cannot really judge them based on what they are doing. Okay? So, perseveration. So, repetition of words, phrases of ideas. So, for example, okay, perseveration, repetition of words, phrases, or ideas. So, na ng example ko, perseveration. So, gina-repeat niya ang words. Okay, so hindi man siya stutter, pero do gina-repeat niya lang. Yapon. So, for example, I am happy, 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 happy. So, perseveration na. Okay, word salad. So, randomly spoken words. So, kung nagaman siya, salad, dog, cat, basta hindi coherent ang sentence. Gets nyo? So, mamangkot lang siya, what is your name? Dog, cat, dog, cat, grocery, name, Tom, gina-jumbled ang words, randomly spoken words. Okay? So, basic gani, mag-alien speak ta siya gani, like, may alien speak na siya karon. Oh, so, take note mo. Bakit randomly spoken words nang iya na? Basta may dala siyang cross. Mula sa sinyo. Interviewer. Okay, so, so, ano kaya? So, may symptoms ba siya schizophrenia or basi lain na ni nga phenomenon? Okay, so, some things that might happen. Okay, so, after some thought process, so we also need to look into the thought content. So the content of what is in the person's mind. So this refers to the themes that occupy the patient's thoughts and perceptual disturbances. So this include preoccupations, illusions, ideas of reference, hallucinations, derealization, depersonalization, and delusion. So if you think of it, ang MSE do halos tanan nga symptoms, signs and symptoms of mental disorder na mention ko dito sa first part. So gina-ask naton because later on you will see sa progress ng aton nga mental disorders nga topic nga ay may mga certain symptoms gali nga ga-overlap. So ang for example, ang depression kag ang anxiety may overlap, may mga symptoms sila that are overlapping. So same man na sa schizophrenia and for example, sa mga traumatic symptoms or for example, sa dissociative identity disorder, di ba? So, one of the rare disorders na. So, how do we know nga may DID siya or basi schizophrenia lang? So, we look into the thought process. Okay, so, the thought content. So, examples of thought content, so we ask them, for example, ang mga preoccupations, so, mga suicidal or homicidal ideation, so, ginapamangkot agad na. So, for example, have you ever thought of killing yourself or may ara ba lang nga gusto nga mag-murder or manakit sa imo? Manakit ang usually, anong Ilonggo? Gusto mo manakit or may gusto magsakit sa imo? Doon mo na. Homicidal ideation. Perseveration, obsessions, or compulsions. So sa OCD, one of the symptoms of OCD is obsession. So when you say obsessions, these are uncontrollable thoughts. So for example, bisan ka pamati ka di sa lecture pero ang obsession mo is that ano ba na close ko bang aircon sa piyak nga kwarto, na ano ko ba na off ko ba ang stove. Do mga obsessions uncontrollable siya, so hindi ka concentrate sa imong lecture kay you are thinking of this, uncontrollable siya. So bisan how many times you try to distract yourself, it will always it will always go do intrusive sa gani. So illusions, so these are misinterpretations of the environment. So ginatanaw taman ni if for example may illusions or hallucinations, ginatanaw taman ni especially if gina-interview natin basi naka-drug siya. Okay, so mapamangkot na. Okay, so ideas of reference. So ideas of reference, ang examples na is for example, what if may duwa that being at other patient and ga-interview nga mga upod mo and ga-storya sila about man intake interview, and then ang imo nga patient nagamo siya kasi ginastoryahan to nila ako tuguro na yung istoryahan nila. So ideas of reference na siya. Okay, so or bisan sa TV makita niya ay ang sa news na basi ako nang ginachika da nila mga marites na daan sila. So na. Okay, ideas of reference. So also we look into ideas of like I said, ideas of reference are misinterpretations of incidents and events in the outside world having direct personal reference to the patient. So bisan ang, for example, bisan ang ang news about pandemic, so feelings ang patient nga siya man gyapon ang gistoryahan. Okay? So hallucinations naman, these are false sensory perceptions. So they can be auditory, visual, tactile, or olfactory. So the most common hallucination is of course auditory hallucination. So we ask the patients, can you hear something that we cannot hear? So depende na sa patient kung honest siya or hindi. Okay, so we practice la nga makita natin if the patient is lying or not. Okay? But the most common is may auditory hallucination, especially gid if if very depressed ang patient or very depressed ang patient or the patient may experience schizophrenic symptoms. So may mabatian na sila nga mga whispers or something or mga buzzing sound, okay? So these are false sensory perceptions, meaning it's not really there. Okay? Kumbaga, hindi naton siya makita, hindi naton siya mabatian. We as observers hindi naton mabatian ng mabatian niya. Hindi naton makita ang makita niya. Okay? Ang illusion naman niya, misinterpretation sang nakita niya. Okay, so for example, yang mga optical illusion bala, 'di ba? Nakita niyo na. So abi sang patient ang nakita niya is face kay gali vase to ya. 'Di ba? May mga muna. Sometimes ang mga abi nato nakita naton. Okay? Derealization is feelings of the outer environment feels unreal. So we often ask the patient, okay, sino ka? Din kasubong kag anong date kag time na. So ang tawag ginatanaw natin ng orientation sa patient. So later on I will talk about consciousness bala ang orientation sa patient. So part man na ang derealization kag depersonalization because a person who may feel derealization or depersonalization may feel that hindi nilabalan kung aga kung gabi na or wala sila kabalo kung din sila subong. So, they may fail to answer those two out of three questions that I told you about. Okay? Sa depersonalization gani, especially if the patient has extreme trauma, they may feel that they are not in their own bodies. Okay? They may feel that the other person, though feeling nila body ni nila gapungko pero ang ilang consciousness ara sa sagwa, the feeling nila hindi sila in control sa ila body. Okay? So, example. So, delusions. Delusions. So, these are fixed false beliefs firmly held in spite of contradictory evidence. Okay, so examples of delusions are delusions of control. So, outside forces are controlling actions. So, mahambal ba yung patient na hipos ka lang ha? Pero feeling ko ang may alien nga sa akon, ga-control sang lawas ko. Kung ang basi gina-control ang ginahambal ko ni Simo, scripted lang ni sa kaya ang government gina-control ako ginahambal. So buligi ko. So despite nga may evidence na may concrete ka evidence nga wala man sang may galaga sa iya o kung wala man sang alien. Okay, so the firmly held belief yagid na and it's inflexible. Okay? Erotomatic. So, a person usually of higher status is in love with the patient. So, mahambalbi ang patient na si ang crush ko na lang. si Tom Hiddleston. Mapakasal na kami sa December. Balang ko in love na siya sa akin. Makadto di siya sa Philippines. So, despite na evidence na balaan ko man nga may miga naman si Tom Hiddleston. So like, sad sa ako siya. Pero kung erotomanic na siya, mapatigin na siya pakaslan gid saya do mo na. So firmly held belief. Something like that. So basi ka mo man ng mga unrequited love niya. Hopefully hindi siya mag-delusion ha. Okay? So grandiose, 'di ba? So 'di ba kung kisam na grandiose. So, inflated sense of self-worth, power, or what. So, maghamba siya nga, by the way, ako gali si Jesus. Ako ang savior sang humanity. Okay? Ako ang, I can control the pandemic. I can just simply stay stop. You know? No sense of grandiosity, gani, power or wealth, to feeling siyang pinakamayaman. So delusion siya. Delusion siya kay despite may evidence ka, gapati man siya gapon nga amo na. Okay? Somatic. So the patient may feel that they have a physical defect. So medyo tricky man kay may mga somatic symptom disorders kita. Pero one example of a delusion nga somatic is nagamba siya balaan ko nga gin-harvest sang kay for example nabala di ba sa Squid Game may mga gapang harvest organ tapos for example balaan kita mo ning scar ko for example ginkuha na sa mga organ harvesters despite contradictory evidence nga wala man na natabo, di ba? Balaan ko ginkuha sa mga aliens ang akon nga liver or kidney tapos ginhatag to nila para sa ila nga do biological weaponry, something like that. Mahimo na sila sang evolved being. No feeling ko do buang. Sorry. So, ideas of reference, or delusions of reference, ang hamba ko sa inyo, unrelated events apply to them. Okay? So, pati pandemic, ay about na sa ako ng pandemic, ang nagka-pandemic, kay tungod nga, nagkaon ko sang something like that. So, abi nila muna. Despite contradictory evidence, despite contradictory evidence. Persecutory, so others are trying to cause harm. So, gapatigid silang, nga, si ma'am na mun balaan ko gid nga akig-akig na siya sa mon ginadumutan niya gid ko na 5.0 yako, like despite contradictory evidence nga makita mo man sa grades nga 1.0 man siya per feeling nga ibagsak kid siya ni ma'am. So amo na persecutory, or others are trying to cause them harm. Okay, so bisan alien, so like gambal sila nga, sa year 2021, sa December nga ni, ma-end ang world. Despite contradictory evidence, bisan may evidence ka na, ano ni siya? Hala, nagkapasaya. So, na. So, cognition. So, during hamba kasi yung levels of consciousness, ang tatlo ka ang levels of orientation, or orientation times 3. So, diri ginatanon yung attention and concentration, meaning the ability to focus, sustain, and appropriately shift mental attention. So, may way na siya to measure attention and concentration. So, I will discuss man later. So, memory. So, immediate, short-term, or long-term. So, gina-measure man naton. So, abstraction. So, how do they, for example, sina is proverb interpretation. So, may proverb ka di, or saying ka bi nga ipa-interpret. So, for example, anong proverb niya, balaan nyo man, time is gold. Anong meaning sina para si mo? So, that's, you are asking abstraction questions. Okay? So, ang ginagamit naton pang measure sang condition is the Falstein Mini Mental State Exam. So it's a 30-item screening tool. It's useful for documenting a serial cognitive changes and cognitive impairment. So ginagamit ng Falstein Mini Mental State Exam to measure levels of consciousness or how alert the person is. Attention and concentration. So for example, may questions siya being ipamemorize sa inyo, tapos i-repeat mo na siya. So, amo ng mga example questions sa Falstein Mini Mental State Exam. So, I will show an example of Falstein Mini Mental State Exam, but I'm not requiring you to do this. So, sa next sem talang ni ubrawon ang Mini Mental State Exam because it requires face-to-face gid yang observation. Kay may mga task ka nga ipaubra sa isa ka tao. Okay? So, insight or judgment. So, it's awareness of one's own illness or situation. So, may mga disorders daan na sometimes the patient is not aware that they are suffering with it. So, for example, like schizophrenia. So, since very disorganized ang ila thinking and they may they may experience delusions and hallucinations. So, sometimes even they are not aware that they are suffering from schizophrenia. So other disorders like mood disorders like depression and bipolar disorder. So sometimes the patients are aware that they are really experiencing those symptoms. Okay, so that's insight. So judgment is the ability to anticipate the consequences of one's behavior and making decisions to safeguard your well-being and that of others. So ang example question sini is for example, may nakita ka nga 1,000 pesos sa dalan, ano ubrahon mo? So you are measuring the person's judgment. Okay, how does that person think? Okay? So, amo ning example of an initial MSE of a patient with depression and psychotic feature. So, appearance. So, for example, ang imbutang disheveled, somnolent, slouched down in chair, uncooperative. Behavior. So, psychomotor, retarded, poor eye contact. Speech. Moderate latency, soft, slow with paucity of content. Mood. So, nagambalbing patient nga, I'm really down. So, you put there in quotes. Affect. Blunted, mood congruent. Thought process. Linear and goal-directed with paucity of content. So, thought content. So, plus HI meaning may suicidal ideation. Plus AH meaning with auditory hallucinations. Plus paranoia meaning with paranoia. Minus VH meaning wala siya sang visual hallucinations. Minus IOR meaning wala siya sang ideas of reference. And minus HI meaning wala siya sang homicidal ideation. So, cognition, the patient is alert and focused. So, sa mini mental state exam, naka 24 siya. Okay, so, naka-miss siya recall of 2 objects, 2 orientation questions, and 2 on serial 7s. So, insight is fair and judgment poor. Okay, so that's the initial sample of an MSE with a patient with depression or psychotic features. Okay, example lang ni. But, of course, ang role naton as psychometricians and as psychometricians, we are not there to diagnose the patient. We are just there to write down what we have observed and we let the doctor diagnose man. So, since the MSE is prone to subjectivity, so meaning one observation may be different to another, so it's best nga at least may duwa ka observation. So, ang imong observation kagang doctor's observation before ang doctor or ang psychologist mag-diagnose. Okay? So, in summary, by the end of a standard psychiatric interview, most of the information for the MSE have been gathered. So, the MSE provides information for diagnosis and assessment of disorder and response to treatment over time. So, remember to include both what you hear and what you see. Okay? So, before I proceed to the intake interview assignment, so do you have any questions that you would like to ask? Wala man ka mo klase after 4, di ba? Wala naman si ma'am. Basta may question ka mo before ka mag-ano sang interview about the MSE or anong mga about sa interviewing techniques.
Ma'am, excuse ma'am.
Yes, Mr. Pagara.
Okay. Ang nag-a-ask naan, ma'am, okay lang ko na ma'am kung fictional character ang gamitin sa case. Fictional ang case sa case conference ang gamitin.
Yeah, I told naman everyone na okay lang kung fictional character. Mas okay na gani kaysa sa real life character. Okay, kaya ang precaution ka lang kung real life nga person is dapat may ara na gid siya diagnosis before nyo i-present. Kaysa nga wala pag gali diagnosis kag present ka lang da. Okay. Sige, questions pa gid before ko mag-proceed sa interview assignment? Wala na? Okay, sige. So, sige, for your intake interview assignment, so I will orient you. Dali lang gid. I will change scene. Kitaon sa inyo class ang instructions? Or zoom in ko pa? Okay.
Medyo blurry siya, ma'am.
Medyo blurry siya. Sige, may ano man kamo sa inyo nga modules. So, for your interview assignment, so like I said, so you are going to be grouped into pairs. So, pili kamo sang partner nyo. And I think we have done that already and arrange. And you will use the MSE for your interviewer's notes that are posted by your teacher in your modules. So, sa inyo nga daan nga modules, so may-ari na di sang nabutang ko na ding mga about sa MSE sa module TRE, Mental Status Exam, MSE, Mental State Exam Checklist. So, tanan, nabutang ko na da. You may use that. Okay, so how you may choose your own partner. Patamba ko gani sa inyo, choose someone of your same sex. So, like I said, di ba, gahalong lang ko sa inyo. Kaya, syempre, we don't want man na boundaries will be overlapped, diba? So, or boundaries will be crossed. Gali. Sorry. So, hamba ko gani. As much as possible, laki sa laki, bay sa bay. Okay? So, you can only choose from your own blockmate. Okay? Do not interview someone who is not part of my class. So, kaagi na daan nga ang instruction ko, classmate nyo lang. Pero ang nag-interview siya sang hindi niya classmate. So, ang danger sinadaan is that, di ba, we often get the impression nga, ay, kung say ka, basi say kuhon ko ni nila, di ba? So, So, since we are still practicing, hindi pa kita expert, di ba? So, sa classmate nyo lang anay. Kaya daan, maybe people will misinterpret what we are doing. Okay? So, especially, very sensitive ni daan man nga, mga information ang kwaon nyo from your classmate. Okay? So, okay lang? Muna aton rule ha. Sa klase, classmate nyo lang gid ang i-interview nyo. Okay? So, mag-work na kamo or mag-OJT na kamo, you can always, maka-opportunity na kamo maka-interview. At least, prepare na kamo. You know how to do it. Okay, so how to do the intake interview. So what I'm doing right now is the detailed instruction. So number 1, set an appointment with your partner to when to conduct your interview. So, syempre, kay online, hindi kita ka face-to-face interview. So, via video call lang, anay. Okay? So, second is establish rapport with your partner. So, sa establishment of rapport, ida siya sa number 1 tato. Sa number 1 tato sa aton nga slide bala nga number 1 sa slide pa, which is sa reason for referral. So before kita makapangayo kung anong ilang mga present nga ginabatsyag, so establish ta anay rapport. So alangan, 'di ba, alangan nga diretsyo na dayon kita mag-interview. So kamustahon ta anay sila. So kamustahon tang how are you? Okay, introduce yourself first, anay. So, for example, you can pretend nga you're a psychometrician. Okay, so assessing neuropsychological exam for ABC company or ABC school. Okay, so pwede na. Tapos, tell your partner what you will do today. So, hambalon nyo nga, okay, I'm just going to get some information para mabalaan ko I will just get information para so that the doctor can review your history, something like that. Pero hindi nyo pag-mention nga makuha sila sang MSE. Okay, so interview lang. Okay, so because you are there to get, pwede mo man explain nga ang assessment gani is para sa, for example, based on my experience, kayo since puro mga court cases, so ang interview nga ni is hindi ni siya para i-judge ka or put a sentence on what you do, pero this will just be the information gathered here will help us to paint a picture of who you are. Okay, so pwede na mahambal. Okay, so once you establish rapport, use the intake interview form as your guide. So sometimes one important way man of establishing rapport is pamangkoton mo sila. So kakaon ka na ba? 'Di ba? So, 'di ba sa Maslow's hierarchy of needs, 'di ba? So, naunta na yung physiological needs ng client. So, kukuton ta sila. Kakaon ka na, kapanyaga ka na, kay based on my experience sa psychological assessment, aga pa na sila gakadto sa clinic or sa hospital. So, sometimes, ang patient namon wala kakaon, kay gahulat sila. Okay, so, ginapakaon anay namon sila before sila magbalik liwat. So, importante nga full ang stomach. Okay, kay paano karon sila ka-cancer sa mga questions. So, physiological needs, safety needs, diba? So, amo na i-establish ninyo. Okay? So, after you have established your rapport, use the intake interview form. So, ipakita ko na siya later as your guide. Okay? So, kumbaga intake interview form, yung guide questions, yun na siya. So, pwede nyo na masulat ang mga raw yung mga information nga nakuha from your client. Okay? So, ang isubmit nyo sa akon is the intake interview report and the intake interview guide or form together with your reflections answering the following questions. So, same, sa isa lang na siya ka-word file. Kumbaga, ang intake interview form kagang intake interview nga report, sa isa lang ka-file. Wait. Mugin man lang yung pa-send ko sila. Wait lang ha, double check ko lang yung pa-send ko sa ila. Kung intake interview report lang gid. Yeah. Intake interview, ano lang. Both. Gid man gali. Intake interview report kag intake interview guide. Gin-double check ko lang, class. Sorry. Para karon later kung may ano. Okay, so, Ariha, so daan, may intake interview report. Okay, so amo nang isubmit nyo. Kagang intake interview guide or form. Amo man nang isubmit nyo sa akon. Isa lang gina siya ka-file together with your reflection question. So, answeran nyo ni after nyo na ubra ang intake interview report. Okay? So, ang reflection question is, how was your experience being the interviewer? Okay, what were your thoughts, feelings, and behaviors when you conducted the interview? Ano yung mo first impression sa imo partner or client? So, were your impressions wrong or correct? So, letter B, how was your experience being naman an interviewee? Kung ikaw naman ang gina-interview. Okay? Kaya, di ba, both kamo ma-exchange information. So, your partner first will become the interviewee, tapos ikaw ang interviewer, and then mas switch naman kamo role. So, siya naman ang interviewer, ikaw naman ang interviewee. So, amo na nga, may A and B. Okay? The questions. And, of course, how vital is assessment in the diagnostic process? What lessons have you learned during the intake interview process? Okay? So, important man ni nga, okay, what is the role of assessment, especially before we diagnose someone with mental disorder? Because sa modules 1 to 3, modules 3 gani, it's focused on the assessment kid mismo of the client, di ba? So, in summary, these are the things to submit. The intake interview report. So, amo na ang summarized version. The intake interview guide or form. Amo ning inyong raw interview notes or raw behavioral observation. So, sa raw interview notes or raw behavioral observation, okay lang nga scrambled, disorganized, or ang imo nga notes yun na mo. Okay? Or bisan hindi siya naka-English. Okay? Kay raw ni siya mo, raw intake interview guide or form. Ang report, amo na syempre ang translated. Okay? So, wait lang gid. Sabi ko. Okay, wait na. Okay. Excuse me. So, besides the intake interview report, the intake interview guide, the reflection paper. So, as much as possible, submit your assignment in one file. So, these are the other files that you need as your guide to your interview. So, no need to submit this. So, you can use these guides as you ask questions to your classmates. So, di ba sa rapport pa lang yan naton, informed consent. So, i-download nyo lang ang informed consent. So, amo ni siya. So, just change the name here. Okay, so, and then, kailan for both ni siya Site 102 and Site 3205. So, later on sa next na nga, SEM, Site 205 naman di, isla nyo naman ang subject. Okay? So, additional instructions. So, in case of uneven pair groups or if you have no partner, so na-arrange na siya natin kagapon. Okay, so please keep these files, ang intake interview report and intake interview guide. Okay, hindi nyo pag-delete ni after this SEM ends ha, because you still need that information sa next SEM. Okay, kay gamiton tana. Okay, so also the reason for referral, para may fix data or basi may ara pagid other reason for referral imo nga client, pero for those nga hindi makaisip kung anong reason for referral, so how can the client better function or cope in his or her life? So studies, love life, family life during this pandemic. So amo nang aton nga reason for referral. Sige, so ipakita ko naman sa inyo ang aton nga intake interview form. So, ang intake interview form or guide, okay, so, i-share screen ko na lang. Okay, so, kitaon ba siya sa inyo, class? Is the visible?
Yes, ma'am.
Okay, so is the at least ang document visible? Wait lang it ha. Okay, so muna ang intake interview form ta. So, very good. Very big, confidential. So, tanan, please practice our ethical standards. So, any information written here should be revealed to the authorized person only. So, the authorized person only is ako. So, don't worry, I won't share man any of your sensitive information. Okay, so that's why I cannot hatag ban sa inyo sang sample. Kay, of course, I value man the privacy of my students nga nakaubra sini. So, sa intake interview form, amuning mga kailangan yung questions that you need to ask them. So, feel free to write on this form, okay, or ask, or butang nyo sa extra paper. So, for example, when you do your interview, pwede nyo gini ma-print, diba? So, if very disorganized ka nga klase nga tao, nga hindi mo kaya write immediately sa keyboard, diba? So, you may print this out and then write handwritten yung anay before you transcribe it sa na computerized form. So, you ask the patient's full name, date, okay, date to day na siya ha. So, pwede nyo gina siya pamangkuton. Okay, ano date na subong. So, di ba, orientation. So, ano date na subong. So, kung makambalis ang date, okay, so check ka na sa MSE mo later. So, date of birth. So, ano birthday niya, age, citizenship, sex, okay, religion, okay, educational attainment, civil status, address, and of course, the reason for referral. So, the first batch of questions are the presenting issues. So, for example, who suggested you to come to see me? So, kumbaga ginap-refer na di, sinong referral person? So, pwede nyo man masulat nga ang akon ngalan. Nga gin-refer ako ni Miss Nisin, teacher ko na siya. Diba, we are just pretending kung nabita diba nga kita sa neuropsych nga So, my teacher referred me to your clinic. So, amo na. So, what prompted you to come to seek treatment now? Or what brought you here? So, pwede to mahambal ang presenting issues niya. So, anong iya nga nabatsyagan at the moment? Or, basi may mga problema siya? Or, simply basi for work man lang? Kaya diba may amo na sa neuropsych ka mga for work purposes. Okay, so what do you think is important to know about you? So, si client yun na ang ma-tell. Okay? So, tell me little about yourself. Tapos, ari pagid, ang mga major crisis in your life. Okay? And how did you handle them? Okay? So, important in determining what is the present condition of the patient or client. So, how do you see the situation right now? And also, another important question, have you felt depressed or down over the last 2 weeks? So, di ba? This question measures the mood of the patient. Okay, stressors. Okay, are thoughts, mga thoughts in the past of hurting yourself. Okay, or has anyone tried to hurt you currently in the past? So, mga about ni siya sa thought content, di ba? We are asking about whether may suicidal ideation ang patient or may homicidal ideation ang patient. So, same man is sa number 10. So, ari pagid. So, history of past or present sexual abuses. So, I know, kung bako ganit, very sensitive ang information yan eh. If the patient doesn't want to answer, so butang nyo lang, no answer, no reply. Okay? Just take down note of what you observe lang gid. So, if, be careful lang improving your classmate. Okay? So, especially if they don't want to talk about the very sensitive information. So, butang nyo lang ang observations nyo. The patient doesn't want to talk about it or the patient doesn't want to answer the question. Okay? Amo man na sa number 12 kagang number 13. Okay? So, So, careful lang kita when asking and probing these questions. Okay? So, patient's history. Okay, so what is your prior mental health history? So, kung kaagi ba siya check up sa isa ka psychiatrist? Okay, yes. No need to record, ma'am. So, so it's up to you whether you will record it or not. Pero, of course, ask for the patient's consent or your interviewee's consent. So, pwede nyo man ma-edit ang informed consent that you are going to record the interview, pero assure nyo syempre sa patient or sa client niyo nga that is for the interview purposes only. Okay? So, kung in real life, in face-to-face interview, wala man namon gina-record kasi syempre the patient will be conscious of what he or she is going to tell us or what he or she is going to behave. Diba? So, may amo na nga factor daan. So, take note nyo lang na. So, any prior treatment, okay? Previous diagnosis, okay? So, did you undergo treatment? Ano naman ang... So, kung kisadaan, ang patient's mental history, pwede na siya, for example, nagka-addiction siya, okay? And then, nagpa-rehab siya, so, amo nang undergo treatment. So, that's why we ask for the patient's mental history. Kung may mga prescription or medication, so especially if, for example, may mga mood disorder siya, so na previously siya na-diagnosed with that disorder, so ginhatagan siya sang doctor sang amo nga prescription or medications. Okay? So also, of course, sa family members niya. So sa family members niyo ba may history of schizophrenia, depression, or any mental disorder? Okay? So, dayon physical health history. So it's not only important that we take note of the patient's mental history, but also the patient's physical history. Kay nadaan, before the doctor, especially the psychiatrist, prescribes medication, ginapamangkot natin sila kung may high blood sila, kung may diabetes, kung may kay certain psychotropic drugs may have a negative effect sa ilang physical health. So, amo nang ginapamangkot na sila. Okay, so, you have any previous health problems, sorry sa typo, so kung may mga injuries, illnesses, kung nagka-aksidente siya, so papakuto nyo man na, eating and sleeping patterns, sex life, okay, exercises, current medications, okay, when was the last time you had a physical exam, okay, so when was the last time, so maybe, ang mga, pagpa-vaccine ninyo, dito lang ka muna ka-check up, di ba? So, muna. So, who is your primary care physician? Sino inyong doctor? Okay? Kung wala siya doctor, leave blank lang eh. So, sa family members nila, do they have any health issues? May high blood bala sa pamilya nyo? Diabetes? Kidney problems? So, sino na sila? Anong nature sang issue? Okay? So, another is substance use or abuse backgrounder. So, ginapamangkot naman ni kay before man naan naton kita ka-rule in sa mga possible mental disorder diagnosis, ginatan-out whether that certain mental disorder has been because of an influence of a drug. So, manotice yun na later on when you read the DSM-5, may ara gina sila nga mood disorder because of a substance use, di ba? May amo na nga diagnosis. So, ginatan-out taanay kung kaagi sila gamit. So, substance, so cigarette, age of first use, so saan o sila una panigarilyo, last use, saan o ang last nila gamit, frequency, kada saan o sila, current use, okay, dom na. Marijuana, okay, so depende na sa client kung maging honest siya or hindi, okay. So, others, mupagina, kung methamphetamine siya, buni ha, marijuana, muni ang marijuana, cannabis, okay, alcohol. So, may mga damo pa na, different kinds of substance use. So, if you look into di ba sa official site nyo, have you gone to the drugs already na part? Or wala pa? Naka-drugs na ka mo? Mga different drugs? So, sa official site nyo, ma-encounter nyo man na mga different types of drugs. Okay? So, when did you start first using substance? Longest duration. Okay? So, muna. Mga withdrawals. Basta may mga withdrawal symptoms saya. Okay? How did you describe them and when they first appear? Okay? So, if you had prior history of addiction or going to rehab, so what was the longest period of sobriety? So, when we say sobriety, amo nang longest period nga wala gid siya kagamit sang amo na nga substance. Community support. So, does your family support you or may support ka sa government or something like that? Family history of substance abuse. So, sino bala ang gamit sa inyo pamilya sang may panigarilyo bala, may alcohol, so on and so forth. So, do you have any concerns regarding the use of substances? So, kung wala man, wala eh. Okay, so has anyone in your life expressed concern in the use of the substance? Okay, and of course, your interviewer's notes. So, diri nyo mabutang inyo mga behavioral observation. So, kita nyo man dito nga very long tong kagina nga gin-explain ko. Pero ang gina-require ko lang sa inyo is joy math. Okay, joy math. Joy math means judgment or insight. Amaning mga important questions. Orientation times 3. So, meaning you ask them their name. Din sila subong kag anong time and date. Intellectual functioning. So, kamusta? So, are they alert? Do they answer the questions man? Okay. Mood or affect. Okay. Makita mo bala ang ilang mood. Diba? Mood is how do they feel. Ang affect is what do you observe. Appearance or behavior. So, during the interview bala, pag video call nyo, nakapambalay lang bala sa, do feeling mo nakaligo man siya or something like that. So, syempre, di taman sila masimutan kay video call. Pero based sa appearance man, diba? So, muna. Thought content. So, if they said that, they had suicidal ideation or may homicidal ideation, so isulat nyo na. So, this one, hamba ko gani, raw data nyo lang na di. So, okay lang maging disorganized ka di or bulleted form or paano ka mag-take note. Kay diri ka sa intake interview report, mo i-consolidate ang data. Okay, so, wait lang. I-stop sharing ko na naman, kag ma-share naman ko sa bag-o. Okay, so amo ni ang intake interview report. Okay, so diri summary na ni. So date of interview, okay, patient's information, presenting issue, summary na ni sa lahat. Background information, summary. Okay, sa family history, family background. You can also ask them of their childhood history. So kamusta ang ila childhood? Okay, especially if there was a history of abuse. Social history, so kamusta siya with the school or work niya. Amo man na sa work history. Ang legal history is, for example, kung may kaso bala siya, ongoing kaso or previous cases. So, amo na siya. And of course, the behavioral observations. But in your case, MSE lang. and your intake notes. So, ang mga gimpang-butang nyo to sa intake interview form nyo, i-summarize nyo na siya ang behavioral observations ninyo dire. And of course, prepared by name and date. So, butangan nyo man signature. Okay? So, is it clear sa inyo? So, may questions bala, class? Before ko ano yung end? May questions regarding this? Ang activity?
Kapag interview, ma'am, kani ba lang na-interview, normal lang ang behavior yung i-display or kinanglan pa naman mo?
What do you mean, miss?
Like, normal lang. Kung
Be yourself. Oo. Kasi syempre, be yourself. Hindi, don't pretend to be patient, okay? Ano lang, ang pretend lang is ang reason for referral, okay? Hindi ang behavior ninyo. So, base karon naman sa partner nyo. Halat daw si tuntuon niya gali. Okay? Sige.
Thank you, ma'am. Ma'am, excuse me.
Yes, Lars.
Hindi galing, ma'am. Like, ma-inacted, ma'am.
Hindi. Gusto nyo how?
Sorry. Hindi man, ma'am. Nag-clarify lang, ma'am.
Okay, so hindi ka mo mag-reenact, ha? Okay? Hindi pag ganay ka mo kabalo kung anong signs and symptoms, ma-reenact ka. Ang tugin pang ang mga mo ko to, examples lang to, ha? So, examples lang so, hindi ka mo mag-reenact. Normal ka mo. Kumbaga, no everyday patient or client lang ka mo, kun-abi. Ang kun-abi talang is may assessment. Okay? Kagang company to, kun-abi, may company nga mo ni. Okay? Sige, ano pag-head ba si mga questions ka mo?
Ma'am, pwede mo sa Canvas ang PowerPoint sa gin-present mo kagina.
Sige, i-upload ko na lang. Pero, may video man eh. So, ma-review man gapon. Okay. Actually, ang mga ginpanghambal ko na ara naman na sa notes nyo. Na-upload ko na siya sa notes nyo. So, muna. Sige, ano pa ba po? Ano pang mga questions, clarifications? So, hindi ka mo Hindi ka mo mag-pretend. Okay, wait lang.
Ma'am, excuse, ma'am, may pamangkot regarding sa case conference bala, ma'am.
Okay, yes.
Okay lang, ma'am, nga maging fictional character lang ang i-analyze naman, ma'am, no?
Yeah. Okay lang fictional character.
Okay. Sige, ma'am, thank you.
Excuse, ma'am.
Sige.
Ang pag-pass bala, excuse, ma'am.
Yes.
Ang pag-pass bala, ma'am, by partner or individual?
Individual na siya.
Okay, ma'am.
Sige, ano pag-head? Basta may questions pa?
Ma'am, excuse.
Yes po.
What if ang imo nga partner is kagi siya consult sa psychiatrist?
Kag may previous diagnosis, ibutang ka da.
Okay.
I-note nyo.
Yes.
Ara man na siya sa intake interview form. So, depende lang na sa client nyo ha, kung i-disclose siya na or hindi. Depende lang na sa classmate nyo. Respect nyo man ang classmate nyo nga privacy. So, kung hindi gid sa magbutang, butang nyo sa interview notes nyo nga, the patient does not want to answer questions. Tiyan mo na iya. Kay, in reality, may mga amugan man ang mga patient nga wala sila ga-answer question, uncooperative. Okay, so, take note nyo lang. Take note what you see and what you observe. Okay? We are just there to get information. Sige, basi may mga questions pa.
Another pagdali, ma'am.
Sige, yes, miss.
I-Word or i-PDF ang pag-submit?
Isama lang ka word file. Word file lang. Pero one file lang, ha? Kumbaga, i-combine nyo to sa ang tanan nyo nga notes, ang tanan nyo nga nga form sa isa lang ka file together with the reflection paper.
Okay, ma'am. Thank you.
Sige, ano pag-gid? Questions? So, ang submission gali ni after exam pa, ha? Okay? After exam pa man. So, ang exam na to next week. So, next week. The week after the exam. So, amo nang So, in case man nga hindi ka mo kasabit on time, hasta pa man ni December 23 ang availability time niya. Especially gid kung na-timingan nga nagmasakit ang imo nga classmate. So ano na, you can still submit until the end of the term. Sige. Napagid. Plus, sorry, pause. Nagid ko. Questions?
Pero may deduction, ma'am.
Wala
kung
mo
mag-submit
ga-deduct.
case, ma'am.
Wala man sa rubrics. Wala man ko ga-deduct. Don't worry.
Thank you, ma'am.
Ginatanaw ko man gapon ka mo on how you put your information. Ano pagid class?
Sa lang ka case, ma'am, no?
Sa diin na, miss. Sa
Sa
case conference, oo.
Case conference.
Isa lang ka case. Isa lang ka disorder. Tapos isa man ka case. Okay. Napagid. Questions? Okay, wala ko. Ay! Wait lang. Mr. Ardenia? Harkade? Manila 7, sila kag. Pilagin man ang boys. Class, pila. I think you should talk with the guys, Mr. Sobrevega. Because for I know, abi ko 7 lang ang boys. So kindly arrange with them kung sinong partner mo. Okay? 1, 2, 3, 4, 5, 6, 7, 8. So, kindly arrange with them na lang. Okay. Sige, any more questions, clarifications before we check our attendance? So, manihambal ko sa inyo ha, Joy Math. So, tandaan nyo lang ni. So, maning mga major nga i-observe nyo sa patient or client nyo. Judgment, orientation, intellectual functioning, mood, appearance, and thought content. Amo lang gid na. Okay, Joy Math. So, basic lang na. So, later on, mag-expert na kamo, mag-psychometrician na kamo. So, you can take notes gid of it. Okay, so practice lang na. So, subong it's okay nga. May balang ko dan, once nga maging expert na kamo, nga bisan, sige-sige lang interview nyo without taking down notes. So, sa hulihi ka na lang ga-take down notes. So, kaya since ka mo, beginner pala ka mo, it's okay to take down notes. Okay? Practice. Before interview, kung nakulbaan ka mag-interview sa classmate mo, practice nyo yung interview form. Okay? Look at the mirror, interview mo daw sa sarili mo. Pero make sure mo lang wala tao, basi abi nila karon gato ka sa self mo, abi karon nila nga may mga hallucinations ka karon. Okay, so ano lang ha, practice, especially gid. I know some of you are shy. Ako man daan, personality ko man very shy gid ko. So one of my weakness gid is interviewing, pero amo ginang ako nga weakness, pero ginatry ko gid, gina-practice ko gid. So ang constant daan more on analysis gid ko ya. So mag-psych assessment dito gid ko gabira sa analysis sang mga question sa mga behavioral observations sa mga pero mga interview, mga information taking. So weakness ko man na. So sometimes your classmates will MMK there. So take note yung man na nga kay the patient or the client is really talks about his or her life. Kaya kung kisa may mga patient nga very talkative, di ba? Ang batang circumstantiality kag tangentiality, kung kisa ginaliko-liko lang nilang storya before kanila magkadto sa point, may ara man nga gina-avoid din nila ang question or tangent sila sa question. So I take note naman na. Okay? Sige. May concerns pa? Violent reactions? Okay, so I think I will
Excuse me.
Ma'am, may additional
may question.
questions.
Okay, wait.
Ano
Ano po?
dala daw sa points ang internet connectivity sa reporting.
Gibutang ko man sa elocution, pero nabutang ko man kung internet connectivity is to be considered. So, syempre, prepare nyo lang internet ninyo. Pero syempre, I will understand man if you have budlayang internet connection. Pero like I said, be prepared gid ka mo always. So have plan A or plan B, okay, in case nga your classmate will get disconnected during the reporting, or for example, basit na lowbat ang cellphone sa classmate mo sang ang ga-present, so sino ang backup, so backup plan gid ka mo, okay? So amo na siya ang life, kailangan natin backup plans, okay? Sige, any more?
Excuse me.
Yes, BP?
Ang kaginab lang kay sa questions bala to ma'am sa homicidal or sa ato balang sa wanting to herself, kung hindi siya di ma'am physical ya ma'am or tawag sina mental, it's
Yeah,
more
nga-
like kung
Kung psychological nga, basta feeling
Ano
niya
ni-
may manakit sa iya, whether physically.
ano namin ko ma'am kung ano siya biya ma'am, kung like if ever like di ba may suicidal like prefer to kill, kung hindi siya be prefer to kill ang in a like pasyon, like prefer yung maging ma-hurt siya balaya emotionally, may arap na siya nga like do gusto ya like
Gusto niya
instead bala ma-feel ka
masochistic siya, amo na.
hindi do like kaya di ba ang suicidal like gusto niya
More
i-cause
to the lang siguro,
Yeah.
mama.
more
Though-
like siya
wait lang.
emotional.
Though self injury, something like that.
Oo, pero emotional side hindi siya physical nga hurt, like
I-note nyo
gusto niya
lang. I-note nyo
Okay,
na lang. Amo na mahambal ko. I-note nyo tanan nga ma-observe nyo. So,
okay.
mm-mm.
Sige ma'am,
So,
thank you.
note nyo lang. So, kung bisan wala dito sa choices, so, the patient wants to be hurt, butan nyo emotionally. So, so, observation yun na mo. Okay? So, we are just there to give objective observations. Okay? Sige. Wala na concerns? Sige ma. Attendance na ta. So, kalaba sang adlaw. Sige, I'll stop recording.